Welcome! As you prepare to take your baby home, one of the final steps before discharge may be completing a car seat tolerance test, sometimes called a car seat challenge. This important assessment helps ensure that your baby can travel home safely in their car seat. Because late preterm babies are still developing muscle strength and head control, sitting in a semi reclined position for an extended period of time may occasionally affect their breathing, heart rate, or oxygen levels. The car seat tolerance test helps us to make sure your baby can safely maintain these vital signs while riding in their car seat. Before the observation begins, your baby must be at least 24 hours old and have successfully completed their critical congenital heart disease or CCHD screening. These requirements help ensure your baby is ready for the evaluation. Prior to the observation, your baby's nurse will review important car seat safety information with you in your hospital room. This education includes proper harness placement, safe positioning, and recommendations for traveling with your newborn. Your nurse will have you place your baby in the car seat to ensure that you are able to do that properly. After the education is completed, your baby will be brought to the nursery for the car seat tolerance test. During the observation, your baby will remain secured in their own rear facing car seat while connected to monitors that continuously measure heart rate, breathing, and oxygen levels. The observation lasts approximately 90 minutes or the anticipated length of your trip home if longer than 90 minutes, and this will depend on your healthcare provider's recommendations. Throughout the test, a member of your healthcare team will closely observe your baby to ensure they are maintaining stable vital signs while positioned in the car seat. If your baby successfully completes the observation, they are considered ready to travel safely in their car seat. If your baby experiences changes in breathing, heart rate, or oxygen levels during the test, your healthcare provider will discuss the next steps with you. This may include repeating the observation, additional monitoring, or other recommendations to ensure your baby travels safely. Not passing the first observation does not necessarily mean there's a serious problem. It simply means your healthcare team wants to make sure your baby can travel home as safely as possible. Now let's review some important car seat safety recommendations. Your baby should always ride in a rear-facing car seat that is appropriate for their height and weight. Rear-facing car seats provide the best protection for your baby's head, neck, and spine during travel. When placing your baby in the car seat, the harness straps should be positioned at or below shoulder level for rear-facing infants. The harness should fit snugly against your baby's body, and you should not be able to pinch extra harness material at your baby's shoulders. The chest clip should always be positioned at armpit level. This helps keep the harness properly positioned during travel. Your baby's head should remain in a neutral position and should not fall forward onto their chest. Proper installation of the car seat helps maintain the correct positioning during travel. Only use accessories that came with your car seat or are approved by the manufacturer. Avoid aftermarket head supports, strap covers, or inserts that were not included with your car seat, as they may affect how the harness fits during a crash. Bulky coats, snowsuits, and thick blankets should never be placed underneath the harness. These items can prevent the harness from fitting snugly. Instead, dress your baby in thin layers and place a blanket over the harness after it has been securely fastened if additional warmth is needed. For longer trips, plan to stop approximately every 2 hours so your baby can be removed from the car seat for feeding, diaper changes, and repositioning. Car seats are designed for travel and should not be used as a routine sleeping environment once you arrive at your destination. If you are unsure whether your car seat is installed correctly, many communities offer free inspections by certified child passenger safety technicians. Your healthcare team can help connect you with local resources before you leave the hospital. Remember, taking a few extra minutes to ensure your baby is properly positioned can make a significant difference in their safety during every trip. Before we finish, let's review some of the important things we've learned. These questions can help you think about what you've learned and help us know if we've explained things clearly. In your own words, can you explain why late preterm babies often complete a car seat tolerance test before going home? Because late preterm babies are still developing muscle strength and head control, sitting in a semi reclined car seat may occasionally affect their breathing, heart rate, or oxygen levels. The car seat tolerance test helps ensure your baby can travel safely in their car seat. What are two things that must happen before your baby can complete the car seat tolerance test? Before the observation begins, your baby must be at least 24 hours old and have successfully completed the Critical Congenital Heart Disease or CCHD screening. What happens during the 90-minute car seat observation? During the observation, your baby remains safely secured in their own rear facing car seat while their heart rate, breathing, and oxygen levels are continuously monitored. This helps ensure your baby can safely maintain normal vital signs while traveling. Can you describe how the harness should fit your baby? The harness should fit snugly against your baby's body, with the shoulder straps positioned at or below the shoulders for rear facing infants. You should not be able to pinch extra harness material at your baby's shoulders. Where should the chest clip be positioned? The chest clip should always be positioned at your baby's armpit level. This helps keep the harness properly positioned during travel. Why should bulky coats or thick clothing never be worn underneath the harness? Bulky clothing prevents the harness from fitting snugly against your baby's body, which can reduce its effectiveness during a crash. Instead, dress your baby in thin layers and place a blanket over the secured harness if additional warmth is needed. If you're unsure whether your car seat is installed correctly, what should you do? You can ask your healthcare team for assistance or schedule an inspection with a certified child passenger safety technician. They can help ensure your car seat is installed correctly and your baby is positioned safely. Remember, every time you place your baby correctly in their car seat, you're helping protect them during travel. Taking your baby home is one of the most exciting moments of your hospital stay. By learning how to use your baby's car seat correctly and completing the car seat tolerance test, you are helping ensure your baby travels home as safely as possible. Hospital discharge procedures may vary based on your baby's individual medical needs and your healthcare provider's recommendations. Always follow the instructions provided by your baby's healthcare team. Remember to always use a properly installed rear facing car seat, secure the harness snugly, position the chest clip at armpit level, and avoid placing bulky clothing underneath the harness. If you ever have questions about your car seat or how to use it safely, ask your healthcare provider or seek assistance from a certified child passenger safety technician. Congratulations and thank you for completing the Caring for Your Late Preterm Newborn Education series. We hope these videos have helped you feel informed, prepared, and confident as you begin caring for your baby at home. Remember, you are your baby's most important caregiver. Every baby is unique, and your healthcare team is always available to answer questions and provide support. Thank you for allowing us to be a part of your family's journey. We wish you and your baby health, happiness, and many wonderful moments together.